Hi class, my name is Kara Gillison. My topic I'm going to be presenting to you is addressing sensory integration through occupational therapy. Sensory integration. So what is sensory integration? Sensory integration was developed by Dr. Jean Ayres in 1963. Jean Ayres began her groundbreaking research in the 1960s. Sensory integration developed applied neurobehavioral theory that revolutionized pediatric therapeutic practices. It was developed the application of sensory integration theory through evaluation and intervention methods. Sensory integration is the ability of a person to take a variety of sensory input, process, and understand it and use it. What is sensory integration? It is a term that applies to neurological functions. Sensory integration is a term that also refers to a theory that identifies ways in which early sensory experiences are important to normal development. And sensory integration is a method used by occupational therapists to improve the lives of children and their families who are experiencing difficulty fully participating in natural environments where they live, learn, and play. So what are the senses that are involved in sensory integration? One is vestibular, so that would be movement and balance. 2 would be tactile, touch. 3 would be proprioception, knowing where your body parts are located. 4 would be visual, 5 would be auditory, 6 would be taste, and 7 would be smell. So how is information processed? Information is processed through 3 main sensory systems. 1 would be tactile, 2 would be proprioception, and 3 would be vestibular. So how information is processed is transmitters come from the brain. They transmit the information from the environment, and then it transmits over to the brain. So why sensory integration? Sensory integration is so important because it increases interactions with others. It also develops the necessary skills to engage in activities of daily living, like getting dressed, putting on your shoes, brushing your teeth, eating, doing many things for activities of daily living, leisure, and as well play. Also, why sensory integration? It's going to be essential for organization and structure. Sensory integration theory. Sensory integration theory is based off of automatic process. It's based off of natural outcomes that occur. It looks at learning problems, as well as developmental delays and behavioral issues. How is sensory integration used? It is used by understanding the whole environment. It is used by learning. It is used by understanding what's going on around us, and it's used by regulation. So there are concepts through sensory integration, and they're neurobiological based. They look at neuroplasticity of the brain. It looks at the central nervous system and how it's organized. It looks at adaptive responses to the environment, and it looks at a sensory nourishment. So having a good balance of your senses that I mentioned in the prior slide. Development process of sensory integration. Development process of sensory integration looks at detection or registration of sensation. It looks at modulation of sensation. It looks at sensory discrimination. It looks at higher sensory integrative skills, and it also looks at targeted occupations. So we'll be looking at input to sensory integration to output. So we'll be looking at senses, so vision, hearing, smell, taste, touch, proprioception, vestibular, and then it'll connect into the central nervous system. And with these senses, we'll be looking at how it's registered, how it's orientated, how it's selected, how it's integrated, how it's analyzed, how it's organized and planned, and how it's outputted and decided. The results from this would include perception of body or world, maybe an adaptive response, and a learning process. Sensory processing disorder. So sensory processing disorder is problems in directing, regulating, interpreting, and responding to sensory input. It can influence a child's response to the environment, what's going on around them, to people and socializing, and to tasks and activities of daily living, like getting dressed in the morning, brushing the teeth, maybe brushing their hair. I wanted to show you a short video that shows a child dealing with the external environment and how they're responding to the sensory input. So you can see in this video how the child was having a difficult time with sensory input and dealing with the external environment. So sensory integration impacts everyday life. So it looks at, it impacts our activities of daily living, our ADLs, which would include putting on your shoes, brushing your teeth, eating a simple little snack. Social participation, so dealing with people on a day-to-day basis. It can impact education and work. It can impact play and leisure. It can impact our rest and sleep. And all of these occupations will fall in the occupational practice framework under occupations. So sensory processing disorder. So first we're looking at sensory modulation disorder. That is, the categories that fall under that can be over responsivity, there could be under responsivity, and sensory seeking. So and then another category can be sensory-based motor disorder. That can involve postural disorder and dyspraxia. And the third category would be sensory discrimination disorder. This would involve our visual, auditory, tactile, vestibular, proprioception, taste, and smell, which would be all your senses that I mentioned before. The 10 fundamental facts about sensory processing disorder. And there are 10. There's sensory processing disorder is a complex disorder of the brain that affects developing children and adults. Parent surveys, clinical assessments, and laboratory protocols exist to identify children with sensory processing disorder. 3. At least 1 in 20 people in the general population may be affected by a sensory processing disorder. 4. In children who are gifted and those with ADHD, autism, Fragile X syndrome, the prevalence of sensory process disorder is much higher than in the general population. 5. Studies have found a significant difference between the physiology of children with sensory processing disorder and children who are typically developing. 6. Studies have found a significant difference between 7. Sensory processing disorders have a unique sensory systems that are not explained by other known disorders. 8. Hereditary may be one of the causes of this disorder. 9. Laboratory studies suggest that the sympathetic and the parasympathetic nervous system are not functioning typically in a child with sensory processing disorder. And 10. Primarily research data supports decades of anecdotal evidence that occupational therapy is an effective intervention for treating the symptoms of sensory processing disorder. So the sensory, as I mentioned, the sensory processing disorder subtypes. So sensory modulation disorder involves sensory over responsivity. This means too much information coming in. 2 would be sensory under responsivity, meaning information comes in, but there's no response to it. And 3 would be sensory seeking or craving, needing more information in the subtype. So sensory over responsivity. The brain has too low of a threshold. Their sense of tactile, they're having difficulty with getting haircuts. They may be avoiding touching certain textures. They have issues with vestibular. They're disoriented after bending down. They're anxious when their feet leave the ground. They avoid rapid or rotating movements. And also visual. They have difficulty tolerating bright lights. Sensory over responsivity. They have difficulty with the sense of proprioception. They have difficulty under this. They have difficulty being hugged. They have difficulty with people moving their body. They have issues auditorily. They might have fear certain sounds. They're distracted by certain noises, and they frequently cover their ears. And they have issues orally. They're picky eaters, and they have difficulty brushing teeth. Sensory under responsivity, the brain has too high of a threshold. So under tactile, they have difficulty noticing touch. Dressing inappropriately for weather is another thing you'll see with sensory under responsivity. Vestibular, they does not ever get dizzy. They also enjoy going upside down or sideways, and they're thrill seekers. Visually, they often miss what is right in front of them. Sensory under responsivity, proprioception, they have poor body awareness. They are floppy and have poor posture. Auditory, they listen to loud music or TV is loud generally. Talks to self during tasks out loud. and orally may be able to eat anything. So sensory seeking or craving seeks arousal of the nervous system inappropriately. Tactiles enjoys bear hugs, and they crave touch of textures. Vestibularly, their balance, they do a lot of jumping, and they enjoy spinning in circles, being upside down. Also under sensory seeking or craving, proprioception, they love crashing or bumping into objects. They crave high physical activities. Auditory, they speak louder than necessary and needs to listen to music to concentrate. And orally puts anything in the mouth, seeking for oral input. Sensory processing disorder subtypes. Sensory discrimination disorder. So we're looking at visual, the eye, auditory, the ear, tactile touch, vestibular movement, proprioception muscle, and taste and smell, mouth and nose. Sensory discrimination disorder examples: proprioception, constantly slamming into doors, pushing too hard to increase awareness. Tactily, they need to use their eyes when searching for objects in a backpack or purse. Taste, smell, difficulty distinguishing between flavors or scents. Vestibular, frequently falling out of chairs. Sensory processing disorder subtype, sensory-based motor disorder. This involves your dyspraxia. Dyspraxia means difficulty motor planning. Also involves postural disorder, poor to co-contraction, they have difficulty with co-contraction. Their muscle tone is usually low. They have difficulty with equilibrium and posture. They have immature reflexive ability, and they have issues with bilateral integration. So coming to midline, putting hands together, or using both arms and both feet at the same time. Examples of dyspraxia. Dyspraxia, you'll see poor gross motor skills. So running, jumping, you'll see poor fine motor skills. Zipping, buttoning, problems in figuring out how to do movements, dressing, and maybe more complex dance steps. Other examples of dyspraxia would be proprioception, poor motor control and body awareness during dressing, and vision, navigating through crowded hallways. Examples of the postural disorders, you're looking at low muscle tone, maybe slumping in the chair, leaning on things, poor balance, often tripping and bumping into objects, difficulty with riding a bike or jumping, poor stability, sitting in awkward positions, hand and head stability, difficulty when reaching for objects, and use of two sides of the body, not stabilizing paper to write. Sensory processing disorder often asks how they feel about certain things. So they'll be asked, how do you feel about a cold shower? Maybe how do you feel about woolly clothing? Maybe the texture of pantyhose, maybe sweatpants, the feel of Jell-O in their mouth, sounds of birds, bright colored walls in the bedroom, the smell of perfume, maybe elevators, riding in the elevators, the sounds in the elevators, and roller coasters. What is the intervention for sensory integration deficits? Intervention can be provided by should be provided by qualified therapists who have received specialized training. The intervention plan is based on an assessment findings and current research. Concerns are typically addressed as part of a total therapeutic and educational program. Direct intervention may be provided in a variety of settings, including specialized therapy rooms, in private practices, schools, or hospital settings. Consultation includes suggestions for home and community-based activities. An occupational therapy assessment tool that is used for sensory integration is called Sensory Integration Praxis Testing, also known as SIPT. The Sensory Integration and Praxis Test is a comprehensive assessment tool developed in 1989 by Jean Ayres, PhD, for children 4 to 8 years, 11 years old of age. This test was created to assist occupational therapists to understand why some children struggle with learning and or display negative behaviors which are not explained by other diagnoses. The occupational assessment tool that is used, there are certain subtypes that are seen in the assessment tool. First subtype would be form and space. So the test category would be spatial visualization. It assesses visual manipulation, and the problem areas that are addressed are reading, writing, ADLs, activities of daily living, and navigation. The next test category that falls under form and space is figure ground. It assesses visual figure ground. The problems that are addressed in this area are poor organization, losing place when reading, and doing math or worksheets. The final test category under form and space is manual form perception. It assesses shape recognition, bilateral stereognosis. Problem areas that are addressed are dressing, sports, or tasks that do not require vision. The next subtype that they look at in the assessment tool is visual motor. The first test category is design copy. It assesses a 2D construction, a pencil test, or motor planning. Problem areas addressed is reading, writing, and math. The next test category under visual motor is the construction praxis. It assesses a 3D construction block design. Problem areas that are addressed are negotiating self through space and object construction. The final category under visual motor is motor accuracy. It assesses visual motor control of preferred and non-preferred hands. Problem areas addressed is writing, sports, and crossing midline. Another subcategory under this assessment tool is tactile discrimination. First test category is finger identification. It assesses finger recognition through touch. The problem areas that are addressed are fine motor difficulties and weak grasp. The next test category is graphisia. This is assessed is the finger recognition through form. Problem areas addressed are drawing and writing. And the final test category under tactile discrimination is localization of tactile stimuli. It assesses tactile localization, and the problems area addressed are body awareness, tactile, and modulation. The next subcategory is vestibular. A test category that falls under that is kinesia, assessing perception of joint position and movement. Problem area addressed is being clumsy, rough with others, and objects, and breaking objects. The next text category would be stand, walk, balance. This assesses static and dynamic balance. The problem area addressed is poor balance, sports, position of self or function, and poor endurance. The final category under vestibular is post-rotary. This assesses the reflective response of eyes or rotation. Problem areas addressed under this is they moves and spins a lot and avoids movement. They may get car sick or have vertigo. Another subtype under this assessment tool would be bilateral integration and sequencing. Test category, the first one is bilateral motor coordination. It assesses replicating smooth and coordinated bilateral hand-feet patterns. Problems areas addressed are functional use of both sides of body for sports, writing, and play. The next test category would be sequencing praxis. It assesses replicating sequence of both hand movements. The problem area addressed is multi-step direction, avoid sports, reading, and writing. The final test category under bilateral integration and sequencing is space visualization. It assesses preferred hand and contralateral hand use. Problem areas addressed: crossing midline, handedness, writing, and reading. The final subcategory of the occupational assessment tool for sensory integration is praxis. The test category under practice would be postural practice. This assesses imitation of the postures. The problem areas addressed is avoid new tasks, slow to learn new motor skills, and lacks creativity and play. Next test category under praxis would be oral praxis. Assesses imitation of oral movements. Problem areas addressed would be speech production and feeding issues. The final test category under praxis is practice on the verbal command. Assesses following 2 or 3 step verbal commands. Problems areas addressed is auditory processing and following directions. Treatment interventions. I wanted to show you a short video describing the assessment tool that I've presented to you and some of the treatment interventions and activities that occupational therapists will use.
Recently, a panel of leading occupational therapists joined together to provide answers to common questions about sensory issues in young children. Here's what they had to say.
Occupational therapy is a profession that's concerned with how people do activities. And the term occupation means activity, but it's the kind of activities that have meaning and purpose in people's lives. And for children, that is the things that they need and want to do on a daily basis, including learning how to play with others and communicate and be part of their family.
The goal of therapy is for the child to be able to do things that kids do so that they can dress themselves independently, that they can enjoy a birthday party, that they can learn how to ride a bike, that they'll have friends, that they can learn in the classroom, the tasks that they need to learn in the classroom.
Occupational therapists are well trained in developmental assessments. So when children are showing sensory seeking or sensory avoiding behaviors that seem outside of the range of typical, it's a good reason to seek out an occupational therapy assessment. I tested a little guy this week, and he's a very bright boy, and he's in a typical classroom, general ed classroom, and his parents were very concerned because he was just too vigorous in his play.
The child I recently saw came to occupational therapy primarily because he was having difficulties with eye contact. Another concern that was really problematic for him was he was clumsy, very clumsy, and having difficulty really performing writing activities in the classroom.
The child can be fearful of being touched or avoid being touched or not like sounds.
A child might have trouble doing things like being able to balance on one foot to kick a soccer ball. Or they might have trouble also coordinating the 2 sides of their body together, so to bring their 2 arms together to cut with scissors might be more difficult.
Sometimes children have difficulty. The teacher says, go to your desk and we're about to do a table activity. It might be very difficult for that child then to be able to navigate through the room, to remember before they sat down they were supposed to get their pen and paper out from the little cubicle, take it to the desk, then sit down. And it's all those steps and sequencing them in the correct order could be overwhelming for a child that's having difficulty with this.
I often feel like these children come to us a little bit sad sometimes in regards to how much they're enjoying their life and participating.
For the children who come to occupational therapy utilizing a sensory integrative approach, we really have to almost sometimes slow the world down a little bit, right? And what we believe we're doing by allowing the swing to move a little slower is allowing them the chance to catch themselves and balance where they might in the world around them fall off the swing.
Setting up an environment in which the child is learning in a very fun way about their body skiing, how to act on the environment, and also to be successful and enjoy both staying still and moving and engaging in play.
And there's a lot of fun equipment, and it's by design. We use the trapeze quite a bit, so as they're moving through space, they have the sense of their body weight while they're getting the proprioceptive input.
One of the other things we might do with a child is to build an obstacle course. So the child has to climb over and under and through. Again, they're moving their body through space. They're needing to figure out where their body is.
Or it would be immersing themselves in the ball pit or the bean pool so they have a better sense of themselves.
What's happening on the frog swing is when the child's in prone and they're jumping like a frog, is they're getting a lot of input into their vestibular system, that movement sense.
Well, one of the benefits of this therapy is its generalizability. So even though children are maybe playing on a trapeze and hitting a target, those skills do generalize then when the child goes to the classroom or the playground and plays on the monkey bars or copies from the blackboard.
And the research does indicate that providing these additional sensory experiences are related to changes in behavior and motor skill and social development and emotional development.
For parents who are seeking an evaluation from an occupational therapist that emphasizes sensory integration, there are some tools that they should ask if the therapist is using.
Those assessments may include developmental assessments indicating some issue in a specific developmental area, such as language, communication, adaptive skills.
The most common evaluation that's used is called the Sensory Integration and Praxis tests, or the SIPT. And it's a group of tests that look really closely at all the different sensory systems and help to kind of tease out where the areas of concern might be, and also help to show where the areas of strength are for the child.
The goal of therapy is to make functional gains in each child's life. What this translates to is improved confidence, self-esteem, and ability to play with other peers. These are the areas that all families want to excel in. The sooner you start therapy, the faster that gains can be made. However, it's never too late.
For more information, resources, and videos about sensory motor issues and other topics, please visit pathways.org or call 1-800-955-CHI.
So some of the treatment interventions and activities that deal with more of the tactile sense, you'll see them, therapists maybe having shaving cream involved, unscented if possible, Play-Doh, Theraputty, textured foods, finger painting, hair gel, tactile road, playing dress up, maybe having a ball pit, blanket wrapping, a pressure vest, gentle but firm massage, and vibrating toys. Treatment interventions and activities that are used for the vestibular sense, you'll see swings, scooter boards, wagon rides, self-propelling toy cars, slides, obstacle courses, monkey bars, a trampoline, and rolling on a mat. The treatment interventions, activities for the proprioception proprioceptive sense, you may see crash pads, crawling, can crawl through tunnels, over bean bags or pillows, running, climbing, marching, wall push-ups, weighted garments, pressure garments, heavy work, scooter boards, a therapy ball, and jumping on a trampoline, and wheelbarrow walks. The treatment interventions and activities for the auditory sense, you'll see soft music, a soft voice, white noise, quiet room, and upbeat music, loud voices, instruments and noisemakers, white noise, and classical music. The treatment intervention activities for visual sense, you may see soft colors being used, solid backgrounds, dim lights, desk lamps, uncluttered areas, flash light tags, visual schedules, bright colors, and bright lights. The treatment interventions for fine motor supports, you'll typically see hand prep exercises, limit handwriting requirements, maybe alternatives to handwriting. Alternatives would include keyboarding, software, a set of notes, grips, or maybe Velcro on shoes. Treatment interventions for fine motor supports. Therapists will create alternatives and accommodations. There's options in Word and PowerPoint, and sensory breaks between tough fine motor activities. Treatment intervention would also include an environmental support. So organizing supports would include visual supports, color coding, timers, watches, written directions, and written rule reminders. Treatment interventions also include educating family and other supports. Educating them on staying on schedule with the child, pacing their language, using concrete language, and using wait time. What occupational therapists can do? They can use something called the sensory diet. The sensory diet includes providing sensory experiences. It can also provide a combination of sensory experiences needed by a person to adaptively interact with the environment. The sensory diet also includes making the environmental modifications. It also includes modifications and organizing of the environment in order to decrease stress on a fragile sensory system. Those with sensory processing challenge may not be able to filter or focus. They may attempt to adjust in a maladaptive way, and they will require a sensory diet enriched with unique sensations and experiences. Creating the sensory diet. So D stands for do an informal assessment, I stands for individualized, E stands for environmental supports, and T stands for the power senses. So doing an informal assessment, assessing the environment and the individual's response to a variety of sensory experiences. So we're looking at a seeker, an active avoider, an under-responder, or somebody who's overwhelmed. Individualize the sensory diet. What has worked for one person may not work for somebody else. So considerations for the sensory diet. So for some child that's an under-responder, increase the use of visual supports and routines, structure the environment, give them time to respond, carefully encourage, and try new experiences. Considerations for a sensory diet with the seeker: provide sensory experiences frequently and proactively. May need to limit time and excitatory experiences. Consideration for a sensory diet of a child that's maybe overwhelmed: control the environment, limit stimulation, limit change, prepare for changes, when they need to occur. And then considerations for a sensory diet for an active avoider. Modify the environment to reduce the need to escape. Gentle introductions to new experiences. As an occupational therapist, we can recommend support groups for families that are out there. There are many out there through the website. So as an occupational therapist, you can print out these websites or direct families to get involved in that, because there can be a lot of stress related to having a child with sensory disorders. Evidence-based research. So under evidence-based research, I had found an article called Development of a Fidelity Measure for Research on the Effectiveness of the AIRS Sensory Integration Intervention. The intervention was guided by a sensory integration theory, is commonly used by occupational therapists with children. Specific intervention methods called sensory integration vary widely across the geographic locations. The purpose of AIRS Sensory Integration Fidelity Measurement, developed by the Sensory Integration Research Collaborative, is to provide a tool that will document whether intervention is carried out in accordance with essential procedural aspects of the AIRS sensory integration intervention, to monitor a reputable AIRS sensory integration intervention delivered in research, such as randomized clinical trials, and differentiate between AIRS sensory integration and other types of interventions. So in this evidence-based research, data showed that the AIRS sensory integration fidelity measure is a reliable and valid instrument for determining whether an observed intervention session represents occupational therapy using AIRS sensory integration intervention. Populations that benefit from the sensory integration include school-age children, adolescents and young adults, and adults. So how can an occupational practitioner help? They can help by collaborating, identifying and modifying, teaching and modeling, identifying the sensory processing disorders, help and provide. How can caregivers and families help? Well, they can help by observing, providing, encouraging, seeking advice, and getting a consultation with a physician and school district special education team. So that is the end of my presentation on addressing sensory integration through occupational therapy. Thank you.